Hi everyone, my name is Jada Hancock and I'm a part of the Adolescent Health group for the Wiki page project, and we primarily focus on adolescents' mental health, specifically body image and self-esteem issues in adolescents' health. This issue is prominent in the youth today because of the rise of social media and the unrealistic body standards that social media has put upon many adolescents. It's important to recognize and take care of adolescents' mental health because this is a crucial part of their lives, and if their mental health is low or if their mental health is not where it needs to be, it could cause symptoms of depression, anxiety, suicidal thoughts, isolation, and just a lack of enjoyment in day-to-day life. Prevalence of low self-esteem in adolescents stems from family comments, bullying in school, social media, different things of that sort really is playing a part in the way that adolescents feel about themselves. A lot of adolescents going through puberty, their bodies are changing, kids are mean sometimes, and it can make them feel as if they don't fit in or if their body isn't good enough because it doesn't look like the next person's, because they are at a susceptible age where they are very sensitive, and it is not a good age for them to have harsh comments made about their body. Self-esteem impacts anxiety, depression, and academic motivation because low self-esteem can cause high anxiety as well as a high chance of experiencing depression. And low self-esteem can also cause a lack of academic motivation because of isolation and just no enjoyment in being around and stuff like that. Adolescents, especially in middle school, they would tend to try to stay home from school so that people won't see them because they feel like, oh, this person said something mean to me, I'm not good enough, and it can really impact their overall mental health. And the negative body perception in adolescents, it is vital. It's vital to recognize this and handle it head on then. Waiting till later can cause a lot of more problems instead of just fixing the problem head on. That is why within our group, we believe that psychodynamic therapy will help adolescents improve self-esteem by increasing self-awareness and emotional understanding. This intervention of psychodynamic therapy will really help adolescents that experience low self-esteem and stuff by changing their negative and pessimistic thought patterns into positive thought patterns. It will allow them to replace those negative thoughts with maybe affirmations or just changing the way that they view themselves. And it starts with their thought patterns. Psychodynamic therapy is derived from psychoanalytic therapy, and it is a form of talk therapy that includes talking about problems in a therapeutic setting. So the goal in psychodynamic therapy is to overcome those negative thought patterns that is formed from past trauma. That past trauma can come from peers, family members, social media, little things like that may seem little, that they don't recognize is just suppressed trauma that they don't realize that is still affecting them to this day. This form of therapy will help for adolescents to raise their perception of their body image and make them feel like a positive image of their body and just their overall self, because it will allow them to dig into any suppressed trauma that they're not aware of and just heal the root of it. Hitting the root of it for adolescents is a very key component of psychodynamic therapy. It unconsciously allows them to think positively pertaining to themselves, and it will help them in the future to recognize that they are beautiful. Their body is fine. Everything is fine. Just to be confident regardless of what they look like, and just knowing that everybody is not supposed to look a certain way. And overcoming these negative self-talk and replacing it with positive self-talk will shift those negative self-beliefs with positive self-beliefs.
Hello everyone, my name is Sofia Tagle and I'll be explaining the section on how psychodynamic therapy works for health in adolescents. Psychodynamic therapy focuses on early childhood behavior and what triggers these different behaviors for children. It helps individuals see how past behavior shapes the person they are and strive to be in the near future. It also focuses on current life situations and how to resolve them to prevent them from happening in the future. Psychodynamic therapy helps and focuses on unconscious behavior, which includes different thoughts and feelings going on in the adolescent's life. With this therapy session, we will include how the client is feeling in current time and how we can focus on helping them conquer their difficulties in present time. We will focus on building a good relationship with the therapist and client so they can feel like they are in a safe space and open up more to the therapist. The therapist's job is to focus on the why the patient is acting the way they are and behaving, and what also causes them to react the way they do. The therapist will also look for recurring messages that are in their stories. We will encourage the patient to say whatever they are feeling without any judgment. This is how they will feel comfortable and feel that sense of a safe space. The purpose of them saying whatever comes to mind helps the therapist focus on different words they are saying and connecting them to a story. With adolescents, it's important to look at different hidden messages as they still can be immature to express themselves fully like an adult. Psychodynamic therapy differs from cognitive behavioral therapy, which is also known as CBT, because it focuses more on the why versus on the how they think. Psychodynamic therapy also encourages more on the understanding rather than the actual symptom. CBT focuses on the symptom reduction on what the patient is trying to tell. CBT is more of a structured type of therapy, and psychodynamic therapy is more open-ended and less structured for the patient. Psychodynamic therapy can also be very useful for adolescents. At this age, they like to be very expressive and still unsure of many things in life. Adolescents are still trying to figure out who they are and where do they belong, which psychodynamic therapy helps them. This therapy session encourages self-reflection and help them in their confused stages while also focusing on their exploration in life. It is important for adolescents to explore themselves and understand their relationship with themselves. In this psychodynamic therapy session, together with the adolescents, we can understand why they are feeling the symptoms they are feeling and create a safe space for them to be open with us. Thank you so much.
Intervention. Psychodynamic therapy is a form of talk therapy derived from psychoanalytic principles that encourage individuals to explore unconscious conflicts and emotional patterns that influence current behaviors and self-perception, according to Germer and Neff, 2013. For adolescents struggling with body satisfaction and low self-esteem, psychodynamic therapy provides a supportive space to imagine how early experiences, internalized criticism, and social pressures contribute to negative self-image. Research has shown that low self-esteem and distorted body image are often linked to teasing, peer comparison, societal standards, all of which can shape an adolescent's internal dialogue and emotional development. Our intervention applies psychodynamic techniques alongside self-compassion focused strategies, encouraging adolescents to uncover unconscious self-beliefs and reframe them through self-awareness and acceptance. The integration of compassion-based methods within psychodynamic therapy has been shown to reduce body dissatisfaction and enhance emotional resilience. This approach aligns with the child and adolescent anxiety psychodynamic psychotherapy, also known as CAPP, model, which emphasizes reflection, emotional insight, and the recognition of internal conflicts as pathways toward self-growth. Our group's hypothesis is that within these 5 sessions, our intervention will implement emotional insight and self-compassion for adolescents who experience body dissatisfaction. Through psychodynamic exploration and compassion-based reframing, participants will improve their self-esteem and body image. Session 1 is called Building Trust and Exploring Self-Image Origins. The first session focuses on establishing trust and creating a safe environment where adolescents can share experiences openly. The therapist begins with open-ended questions such as, when you think about yourself, what words come to mind? Or, can you remember the first time you felt unhappy with your body? This helps identify early influences on self-image, including peer teasing or parental expectations. To foster rapport, the therapist might use reflective listening, validating the adolescent's feelings to promote a sense of safety and acceptance. Adolescents are encouraged to bring in photos, journal entries, or memories that reflect how they viewed themselves at different ages. This exploration allows for a comparison of how their self-perception has evolved and helps identify patterns of negative thinking rooted in early experiences. Next, we move on to Session 2, Uncovering Underlying Conflicts. In this session, the therapist helps adolescents uncover unconscious conflicts that influence their self-concept. Techniques such as free association or guided imagery are used to explore internalized criticism and suppressed emotions. Questions like, whose voice do you hear when you criticize your body? Or how do you think others' opinions affect how you see yourself? Guide the adolescent toward recognizing external influences. Discussions center on the role of media and social comparison in shaping body dissatisfaction, consistent with research showing that external ideals and peer judgment are major contributors to poor body image. Therapists might also introduce journaling prompts to identify triggers for negative self-talk, building awareness of how these conflicts manifest emotionally and behaviorally. Next, we have Session 3, Interpreting Defense Mechanisms. This session aims to help adolescents recognize defense mechanisms that distort their perception of self-worth. Common defenses, such as denial, projection, or humor, may be explored through examples or role play. For instance, a teen who laughs off negative comments about appearance may actually be masking vulnerability. The therapist could ask, when you make a joke about yourself, what are you really feeling underneath? Or, what would happen if you allowed yourself to feel sad or angry about these comments? These reflective questions help adolescents connect humor, avoidance, or perfectionism with deeper insecurities. As they recognize these defenses, adolescents begin to replace self-criticism with understanding, developing greater emotional insight and the capacity for self-compassion. Following, we have Session 4, Reframing Self-Perception and Developing Insight. In this final session, adolescents apply the insights gained to actively reframe their self-perception. The therapist encourages reflection through questions like, what have you learned about where your self-judgments come from? And how might you treat yourself differently moving forward? Participants engage in self-compassion exercises drawn from mindfulness-based practices, such as writing a letter to themselves from the perspective of a supportive friend. Group dialogue may include sharing affirmations or identifying personal strength, which aligns with positive body image frameworks emphasizing acceptance and gratitude. By the end of this session, adolescents demonstrate increased emotional insight and self-acceptance, reflecting a shift from external validation to intrinsic self-worth, a process supported by research linking compassion and body satisfaction in youth.
Hi everyone, my name is Deja and I'll be discussing the outcomes and reflection portion of our group project on adolescent body dissatisfaction. Our project focused on how psychodynamic therapy, when combined with principles from positive psychology, can help adolescents struggling with poor body image. The goal of our intervention was to guide teens toward understanding the emotional roots of their negative self-image while helping them build self-compassion and emotional insight. By doing this, we hope to reduce feelings of body discontent and increase overall self-esteem. When it comes to expected outcomes, success would be measured using several tools and observations. We would use the Rosenberg Self-Esteem Scale to measure improvements in self-worth and the Body Dissatisfaction Subscale of the Eating Disorder Inventory to track changes in body image. We'd also monitor decreases in symptoms of anxiety, depression, and negative self-talk. Beyond the numbers, success will also show up in qualitative ways, like adolescents being more open in group discussions, showing more emotional awareness, and expressing themselves in healthier ways. Together, these signs would indicate that the therapy is helping adolescents view themselves in a more compassionate and realistic way. If this type of intervention proves successful, it could have some really meaningful implications. It would show that addressing the deeper emotional and psychological roots of body image issues can lead to more lasting change than focusing only on surface behaviors. It could also encourage schools, counselors, and community programs to adopt psychodynamic and positive psychology approaches when supporting youth. Helping adolescents explore their emotions and strengthen their sense of self-worth can make a real difference in how they respond to social pressures, like unrealistic beauty standards and social media influence. Of course, there are challenges and limitations to consider. Not all adolescents are comfortable with introspection or talking about personal emotions, especially if they've experienced trauma or low self-esteem for a long time. It can take time to build the trust needed for this type of therapy to work. Cultural and gender differences might also shape how young people express or interpret body dissatisfaction. Some may downplay their feelings, while others might not yet have the emotional vocabulary to describe them. These are all important barriers to keep in mind. Despite these challenges, creating a non-judgmental, supportive environment can help make therapy more approachable and effective over time. This approach also connects strongly to the ideas behind positive psychology. Positive psychology is all about focusing on strengths, resilience, and personal growth. When we blend it with psychodynamic therapy, we're helping adolescents not only understand their inner struggles, but also build tools for emotional healing. It encourages them to move from self-criticism to self-acceptance and to recognize their own worth. Through techniques like gratitude journaling, self-compassion exercises, and reflection, adolescents can learn to appreciate themselves beyond appearance. This combination of self-awareness and positive focus promotes long-term well-being, not just short-term confidence. Personally, learning about psychodynamic therapy has really changed the way I view adolescent mental health. I used to think body image issues mainly came from social media and peer pressure, but now I understand that they often go much deeper, connecting to early emotional experiences, self-beliefs, and even past trauma. This therapy helps uncover those hidden factors and gives adolescents the chance to redefine how they see themselves. I've realized that healing isn't just about changing behaviors, it's about understanding ourselves and feeling safe enough to grow through that understanding. In the end, this project reminded me that when adolescents are given space to explore their emotions and develop self-compassion, they can build stronger, more resilient identities. That growth doesn't just improve body image, it strengthens their overall mental health and confidence, which can positively shape the rest of their lives. Thank you.
Now that we've discussed the background, theories, and structure of our intervention, I want to bring everything together by highlighting how our psychodynamic therapy approach connects directly to positive psychology and how it supports adolescent growth, resilience, and overall well-being. Positive psychology focuses on cultivating strengths, optimism, and personal growth rather than only treating problems or deficits. Our intervention embraces this philosophy by guiding adolescents to explore and transform negative self-beliefs into self-understanding, self-compassion, and acceptance. Even though psychodynamic therapy traditionally explores unconscious conflicts and past experiences, when combined with positive psychology principles, it becomes a powerful tool for personal transformation. It helps individuals not only heal from past trauma, but also grow from it. Our intervention, we incorporated practices like reflective journaling, emotional insights, and self-compassion exercises, which are all deeply aligned with positive psychology concepts such as flourishing and self-awareness. By understanding the root of their insecurities and reframing those experiences with compassion, adolescents can start to see themselves more positively, not just in terms of appearance, but as a whole capable individuals. One of the main goals of positive psychology is to promote self-acceptance, which is also at the heart of our intervention. Through guided sessions and open discussion, participants learn to recognize their defense mechanisms and understand how those coping patterns once served to protect them. As they gain this awareness, they can begin to let go of self-criticism and move toward self-acceptance. This shift reflects a core positive psychology principle that growth begins when we acknowledge our imperfections and still value ourselves. Adolescents who develop higher self-acceptance often report greater life satisfaction, more positive relationships, and self-susceptibility to the negative effects of social comparison, especially on social media. Another key link between psychodynamic therapy and positive psychology is resilience. When adolescents face the painful emotions underlying their body dissatisfaction, they're learning emotional regulation, the ability to sit with difficult feelings instead of avoiding them. By doing this in a safe and supportive setting, they develop emotional resilience, a skill that will help them throughout life, not just with body image concerns. Through reflection, discussion, and compassion-based exercises, adolescents begin to see challenges not as fixed failures, but as opportunities to learn and grow. This process captures the essence of post-traumatic growth, finding meaning and personal strength through adversity, which is a central concept in positive psychology research. Positive psychology isn't just about being happy, it's about developing insight that fosters lasting change. Psychodynamic therapy encourages deep self-reflection, understanding how past experiences, relationships, and self-perceptions shape current behavior. By adding a positive psychology lens, we transform that insight into empowerment. In our sessions, adolescents are encouraged to identify moments of progress and reflect on how their thoughts about themselves have shifted. This helps them internalize that belief that change is possible, that they have agency over their mental and emotional well-being. Over time, this awareness helps them make healthier choices and build stronger, more compassionate identities. The broader impact of integrating positive psychology with psychodynamic therapy extends beyond body image. By improving self-compassion, adolescents often experience reduced mental health stigma, improved school performance, and a better social and emotional regulation. In conclusion, our project emphasizes that addressing adolescent body dissatisfaction requires more than surface-level solutions. It calls for understanding the deeper psychological roots while also nurturing positive qualities like self-compassion, self-acceptance, and resilience. By integrating psychodynamic therapy with positive psychology, we're not only helping adolescents process negative emotions, we're teaching them how to grow from them. Through this project, our group learned that healing and growth are not separate processes, they happen together. By guiding adolescents to understand themselves more deeply, they can begin to replace self-criticism with self-respect and transform pain into personal strength. Ultimately, the goal of our intervention is to help adolescents realize that their worth is not determined by appearance, but by their capacity for growth, compassion, and authenticity. Thank you for the time to learn about our project and for supporting our vision of promoting positive and mental health among adolescents.
Hi, I'm Maria, and I'll be concluding this segment of our project by showing how psychodynamic therapy connects with positive psychology and the growth it can inspire in adolescents. Over the past few sessions, we've explored how adolescents' negative body image develops, the role of self-esteem, and interventions that help them shift toward a healthier self-perception. So now let's connect all of that to positive psychology. Psychodynamic therapy isn't only about exploring past experiences, as it's often depicted like that in the media. It can be a really great tool for self-awareness, building resilience, and fostering personal growth in adolescents and many people. By examining how these early experiences, peer influences, and internalized expectations shape thoughts about their bodies, they can gain some insight as to why they may feel unworthy or why they're experiencing this body dissatisfaction. This aligns with positive psychology because it emphasizing identifying their strengths, it helps them build a sense of well-being, and it promotes them feeling more positive emotions rather than only focusing on the specific issue of body dissatisfaction. In this way, therapy can help these adolescents uncover the personal strengths that they probably didn't even know they had. So, for example, a teen who constantly criticizes their appearance may realize that a lot of their self-judgment comes from comparing themselves to social media, or something they may have seen on TikTok. So through guided reflection, dream journaling, discussion, they can notice the patterns in their thoughts, and they can begin to finally challenge these unrealistic expectations that they've set for themselves. And by pairing this insight with positive psychology techniques, like practicing self-compassion and identifying their own strengths, they can not only reduce these negative emotions, but they can also build a more empowered and resilient perception of themselves. So, on that note, it's also important to understand that this process won't create shame, even though it involves reflecting their negative feelings. Instead, this reflection and just gaining insight is really a form of empowerment. They can learn to observe their thoughts without judgment and reframe these self-critical beliefs and recognize the value of their unique qualities, and just really challenge these beliefs that they've instilled in themselves. And this combination of awareness and strength building really allows them to take control of their narrative and their emotional experiences, and choose responses that really promote their well-being. This impact will definitely extend beyond just their individual growth. When adolescents develop self-awareness and resilience, they will be more likely to form healthier relationships with their family, their friends, and their peers. They are able to communicate more openly. They can offer support and receive support without feeling ashamed or defensive. And furthermore, these interventions can help reduce the stigma around therapy, which in turn can show adolescents that seeking help for their mental health problems is normal and it's very beneficial to them. And over time, these skills create a more stronger, more confident community where mental health is seen as normal and where it's valued, and just to create institutions that can really help foster the well-being of adolescents.
So, in summary, our project demonstrates that combining psychodynamic therapy with positive psychology strategies like reflective journaling, dream journaling, self-compassion exercises, and just identifying strengths can really enhance adolescents' self-esteem, reduce their body dissatisfaction, and just overall foster emotional resilience. By understanding both the roots of negative self-perception and the techniques that promote well-being, adolescents can gain the tools necessary to maintain lasting positive change. And it's not just about feeling better in the moment, it's about really building these habits that can promote just their long-term positive mental health and personal growth. So, to finish, when adolescents understand why they feel unworthy, they can finally be able to reframe their thinking and rewrite their own story. With the proper guidance, reflection, and of course consistent practice, adolescents have the ability to move toward a feeling more satisfied with their body, a lot of more self-acceptance. They can build resilience, and they can build just a stronger, more positive sense of self. And by fostering these insights and emphasizing strengths, we can help these teens to not only feel better about themselves today, but also carry these lessons forward with them into the future. Thank you very much.